Patients who suffer from mild stress urinary incontinence, who may only wear 1, 2, or 3 pads per day, especially after a radical prostatectomy, are excellent candidates for a male urethral sling. Generally speaking, all insurance plans cover treatment for male stress urinary incontinence, as we're generally restoring function that is no longer present and is more of a reconstructive procedure at that point. There are a couple of different types of male slings available in the United States. Both of these slings are obturator male slings that apply pressure on the urethra to elevate the urethra and restore that support. Coloplast makes the Virtue male sling, and AMS makes an Advance male sling. All male slings are generally made of polypropylene mesh. This is a very safe type of mesh that we've been using for many years, and if placed correctly, has a very, very low risk of side effects. It's important to know that this is totally different than some of the other bad press that some of the vaginal mesh products has received in the lay media. A male sling is performed as a straightforward outpatient procedure. We make a small incision behind the scrotum that allows the urethra to be identified. We'll make a couple of small entry points on the inside of the thighs that allows the obturator sling to be placed in a safe manner to restore that support to the urethra after prostate removal. The male sling works to restore the support to the urethra that is no longer present after prostate removal. This pressure that's applied from the sling relocates that proximal urethra closer to the bladder neck to restore that support. A male sling will generally last for the rest of a man's lifetime and provide a durable, effective treatment option for many years. The data suggests that slings can achieve greater than an 85% dryness rate if patients are appropriately selected. I would say that patients that don't do well after a male sling generally should have gotten a sphincter to begin with because their leakage was so heavy from the start. I will say that having a sling placed certainly does not prevent you from having further treatment down the road. In other words, you can always have a sphincter placed to achieve dryness if the male sling does not work. As with any surgical procedure, there are tiny risks of infection or bleeding. With male slings, there is a theoretical risk of possibly getting the sling too tight, although in my experience that's extremely rare. Occasionally, patients have trouble voiding the next day after the procedure and have to have a catheter inserted temporarily, but I have yet to encounter long-term retention or need for a catheter that required further treatment.